most common reason for deviated septums is the way the facial skeleton develops and grows as you're maturing as a child and as a teenager. And the septum won't finish changing until you've reached facial maturity, usually between the ages of 16 and 17. And because there is often some subtle facial asymmetry, that can lead to the septum deviating as it's developing. The other, obviously, the next commonest cause would be trauma, and relatively minor childhood injury can set the septum growing off in the wrong direction. But obviously we see traumatic cases of sporting injuries and road traffic accidents which produce injury to the nose, which then fractures the septum and causes it to deviate and causes the nasal obstruction associated with that structural abnormality. And the idea of correcting septal deviations is primarily to try and reposition the cartilage and bone of the septum so that it sits as central in the nose as is possible. And that involves very much a repositioning rather than any resection of tissue. The modern septoplasty tends to be a very conservative operation, preserving the strength of the nose as a consequence. But it's primarily about repositioning the deviated bone in the cartilage and sewing it into place, and then allowing things to settle down to reconstruct the structure of the nose.